This is how to complete your documentation using a computer or web browser. Once you're in the client chart, look for the note in which you will be documenting. Under Visits, answer these COVID-related questions and verify your client info. You must click 2 before clicking Save. You are now clocked in, and this is your note where you will be documenting and submitting. Under Initial Assessment, first, document the beginning of shift checklist. So make sure you click that and document the time in which the assessment was completed. Make sure you document each section here in the checklist. And lastly, document who you received a report from. Once you're done documenting here in the beginning of shift checklist, click the green Save button on the bottom right-hand side. You will see that the gray circle now has a check mark because we saved our documentation. Now you can document your vitals. This is your first set of vitals starting of shift. Document your temperature, temperature location, pulse rate, respiration rate, and oxygen saturation. Document blood pressure if applicable, if your patient has a blood pressure medication or if there's an order for it, and then click the green Save button on the bottom right. For prognosis, we don't document anything. It's locked. The system documents it for us, so we'll just go ahead and click Save. Under sensory status, as you can see, it's pre-documented. You can add or remove anything on here according to your assessment, and you can also make any comments on the bottom. Click the green Save button. Next, we have our pain assessment. It will ask if our patient is experiencing any pain. If they are, you will get a series of questions. Pain intensity, if it's verbal or nonverbal. Next, we have our skin condition. So we'll go ahead and document our skin assessment. And as you can see, most of these have our red star next to it. So make sure you're fully documenting everything that's required, or else you won't be able to submit your note until everything is fully documented. Next, for respiratory, we will document lung sounds if they're on oxygen, and then we will move on to respiratory support, which is the second drop down. Document trach site, the last time the trach was changed, trach size and type, and click green Save button once you're done. For endocrine, make any comments if necessary and click the green Save button. Moving on to our cardiac status, document the color, skin temperature, heart sounds, peripheral pulse, capillary refill. So go ahead and make sure you document each section that is required with the red star next to it before clicking Save and moving on to the next section. Under GI, document the last bowel movement, document any feeding tube documentation if applicable. Under neuro, you will document mental status as well, and go ahead and click the green save once you're done. And then musculoskeletal, document any range of motion and make any comments if necessary. After completing your initial assessment, we're going to move on to our interventions. Our interventions are going to show up like this. We have our scheduled interventions and we have PRN interventions. We have a daily task, which we have the note narrative and input/output record. Under note narrative, this is where you'll document any notes throughout your shift. Make sure you have the correct time, and under additional details, this is where you can document your note. We are not documenting every 2 hours like we did in Access, where we had a note narrative every 2 hours. So here we can put in our patient had an appointment, any medication changes, if your patient is experiencing any abnormal symptoms or vital signs, anything that's out of their routine, anything that you need to make note of, you would document it here, put in the correct time. If your patient's experiencing pain, you can document that here, and under PRN effectiveness/reaction, you can document, if they're still experiencing pain after you reassess, and then click save. Under input/output record, this is where you'll document any input or output, so bowel movements, diaper changes, if your patient is vomiting, you're going to document that here. So any output or input will be documented here under this section. Our scheduled task will appear under each hour here, depending on when it's scheduled. And our vital signs will appear every 4 hours. So they'll be scheduled under interventions after that initial vital signs that you documented in the initial assessment. So right here, I would document my second set of vitals in my shift. And then I would click the blue save button once I'm done documenting vitals. Medications will also appear here under scheduled interventions. All of our medication, feeds, daily tasks that were in the ETAR and Access, all of that will appear under our interventions. When documenting medications, if you have a controlled substance, you will see this controlled substance count prior to administration. You must document your count in this documentation here. If you don't document the amount, it will not let you submit your medication entry. And click save once you're done. And you can also link your interventions, for example, linking a water flush to this medication. If you're documenting a medication past due, just make sure that you change the time before submitting it to reflect the time that you actually administered the medication. And if you have anything that's missing, as you can see, you will get a pop-up and it will tell you what you're missing. Make sure you complete all of your scheduled tasks, initial assessment before submitting your note. Under completed, here you can see all your completed interventions, and it will show you by the time in which it was completed. If you want to take a look at orders, go ahead and click orders. If you want to add a new order, you would document that there. This is what the MAR looks like. As you start charting, you will see the MAR being filled up. Plan of care, this is where you'll see a PDF version under POC. You will click parent signature once you're ready to clock out, and remember this must be collected within 15 minutes after your shift. The caregiver will document their name there and then they will sign before clicking submit. And it will tell if you have any outstanding tasks before fully submitting. Next, you will document your password, and then you will document who you left care to, and then click save to fully submit.